wanted to share with you a message that somebody sent me over a couple weeks ago. And I love it when people have questions, because if you have a question, there's a high likelihood that somebody else or lots of other people have the same question. So this was the message. This is somebody that has problems with back pain and is trying to figure out how to self-treat, and it sounds like they've mostly done a really great job. Okay, so this is what the message says. I used to be a weightlifter and my low back became my weak link. I'd say my posterior chain fires dysfunctionally. Okay, so what that means, a lot of people wouldn't even know what that means, but this person has a lot of knowledge about the body and a lot of curiosity about his own body. He used to be a weightlifter, so he's very interested in how the body works and how to get out of pain. So the posterior chain would be like these muscles in your low back. And maybe sometimes people feel like they can't get these muscles turned on to support their structure, and maybe they believe that that is why they keep having pain reoccur again and again. So first of all, I want to say that the muscles are probably not the problem. There are times when people have had pain for such a long outstanding time that they have developed severe muscle weakness and sometimes atrophy. So in those cases, we do have to work a little harder at getting those muscles to regain the memory of how they're supposed to fire. However, from a mechanical standpoint, this is how we look at the problem. When you've had long-standing pain, your muscles do get inhibited. And the reason why is pain is inhibitory. What that means is pain turns off your core muscles. And so you do get weak. If you can recover from pain fairly quickly, then usually you don't need to retrain those muscles. But let's say you have gone many years and you've been dealing with this pain, and now you have muscle atrophy and you just cannot figure out how to fire those muscles. Okay, so I want to take a step backwards, because if you are somebody who has been working on a mechanical approach to pain management and you're wanting to get into a phase called recovery of function, that is the next part of your training. If you have managed your pain 100%, and let's say you've gone a month or longer with no pain bothering you, then you're ready for what's called recovery of function. And that means we are going to retrain you using the most optimal body mechanics for whatever workouts that your heart desires. So, one of the reasons why people can't figure out how to fire these muscles in their back is because there's still some mechanical work that maybe needs to be done. Let's say even if you've done really well at pain management, there is a possibility that you have not gotten all the progressions of movement that you actually need. And this is how we do it. And hopefully this will help you understand if you have not gotten the progressions of the therapy and self-care that you need. So in this technique that I use, called mechanical diagnosis and therapy, we always start with the least amount of movement and strain in order for a person to regain function and reduce pain. Next, we want to make sure that that person is not going to keep having reoccurrences of the same problem, and we do this by constantly assessing the problem and giving incremental progressions along their process. Okay, so this means that if you have a joint that has, let's say, 180 degrees of range of motion, and when you're in the worst bout of pain, let's say you've lost like 50% of your motion and mobility in your joints and you can't move the way you normally do, okay? So we're gonna take that 180 degrees and we're gonna break that down. So let's say when you start mechanical therapy, you start noticing when you do the movements that are recommended, you first are like noticing that you have a loss of motion. Let's say your loss of motion is like 50%, okay? So you're going to do the prescribed motion that was assessed, being the key movement that reduces your symptoms and your pain, and you are going to keep moving through that range of motion that was given to you until, let's say, you've gone as far as you can. And let's say over days and weeks, you have gone from a 50% loss of mobility and motion to, let's say, a 20% loss of motion. So now you've got 80% of your range of motion and you're still missing that 20%. So at that point, that is when you need a little bit more guidance and a little bit more coaching on how you get that rest of that 20%. Okay, you might even feel like you have all the range of motion, but you still feel stuck in your mobility and you just can't get past that. Okay, so this is where either a second person comes in hand, or you have to use some types of props or tools. Okay, so if we're talking about low back pain, and let's say I've given you, which I'm gonna say this hypothetically because everybody doesn't have the same problem, and so everybody also doesn't have the same solution. So if you're suffering from low back pain, and the most common movement that's recommended is extension, okay, which is, it's this motion here in standing, okay? And if you're in a lying down position, the motion is what's called a press up. That movement looks like an upward dog. And if you feel like you're still a little bit stuck at that end range, then you either need a second person to help you gain more mobility by adding external force to your problem. And this is not something that I can give you the answer to in a short video, because this would mean that you need some one-on-one instruction on how to do that. Sometimes I will use props and tools to help people get that motion that they've lost, and so that they can still self-treat. I learned how to do the self-treatment all on my own because I was self-treating my own body. So I know oftentimes exactly what it is that you need in order to add a tool or a prop so that you can go to the next progression of force that's needed. Okay, the reason why these progressions of forces are so important is because if you do not get to the place where you have progressed your force and have gained, let's say, 100% of your normal range of motion and mobility back, you have left enough of the problem still existing that you're going to continue having reoccurrences. And let's say you don't have reoccurrences of pain, but you still might have reoccurrences of weakness, because until you have regained all your full motion and mobility and it feels great and it can tolerate external forces, meaning pressure from a second person or forces from props or tools, then you might still have some muscle weakness that you perceive as an inability to control your muscular strength. Or, as this person said in the message, that they are not able to activate their posterior chain, which might mean that they don't know how to get those muscles turned on in the way that they're hoping, so that those muscles can begin supporting the spine with normal spinal stability. This is a mistake that people often make, is that they go towards core stabilization training sooner than they're ready. That means they skip the progressions that are needed for regaining complete range of motion and mobility, and they move ahead before they're ready to the stage of recovery of function. And then they start doing activities that their body is actually not ready for. And so then when this happens, you're going to keep experiencing reoccurrences of either weakness or pain, and that does set you up to be vulnerable for more injury. So I hope this helps. I know you may have been wanting some specific exercises in order to turn on your posterior chain. But first I need to know that you have gone through all the progressions that your joints and tissues are wanting in order to get to the next phase, which is recovery of function. And I know this is hard for people who like to work out at the gym, because as soon as your pain is gone, you want to hit the gym as soon as possible. And I totally understand. And I don't want to discourage you from moving and going to the gym, but if you are stuck and you are missing that one little last piece, then you might need a one-on-one session to get there. Okay, take care. Hope you guys have a great day. And I hope this answers your question about how to get those posterior muscles in your spine turned on.